October 1944, Monte Battaglia, Italian Apennines. German forces held strategic defensive positions in the mountains, resisting the Allied push toward the Po Valley. Operation Pancake aimed to break these lines through coordinated attacks by regular troops and local resistance groups. His hands trembled, but not from fear. Alexander Morozov gripped the improvised scalpel as he looked at the motionless soldier on the stone altar of the bombed-out church. Out of war doctors were ignored by high command was born a brutal truth. When generals abandoned their men, only those willing to defy orders remained to save them. The young surgeon looked at the 16 wounded moaning on the sacred floor, then at the 4 exhausted assistants waiting for his instructions. Outside, the roar of German artillery approached like an inevitable storm. There was no anesthetic, no plasma, no official hope. Only him, his forbidden knowledge, and an absolute refusal to accept death as destiny. War had ignored doctors for far too long. Chapter 1. The despised Dr. Major Petrov spat on the frozen church floor when Alexander finished outlining his medical strategy. It was the 3rd time that week the young surgeon had requested reinforcements and basic supplies for the field hospital. And the 3rd time he received the same look of contempt. The shattered stained glass windows let in October's cold light, casting dancing shadows over pews turned into makeshift cots. The smell of ancient incense mingled with the acrid scent of homemade disinfectant, a combination that defined this sacred space now turned into a medical trench. Petrov tightened the belt of his uniform and declared in a harsh voice that doctors were a luxury in wartime, not a strategic priority. Alexander felt his cheeks burn with humiliation, but kept his posture erect. At 26, graduating with highest honors from the Leningrad Medical Academy, he knew his youth was seen as weakness by the veteran officers commanding that lost unit in the Apennines. Rain began to fall through holes in the roof, forming small puddles among the wounded waiting for treatment. Alexander moved among them with calculated precision, checking pulses, examining wounds, prioritizing cases with the cold discipline he had learned from forbidden field medicine manuals studied in secret. Soldier Mikhail Volkov, 18 years old, was slowly bleeding from shrapnel lodged in his abdomen, his glassy eyes fixed on the ruined church ceiling. Alexander knelt beside the boy, feeling the rough texture of the soaked uniform beneath his fingers, and murmured words of reassurance he barely believed himself. The distant rumble of German artillery echoed through the mountains like constant thunder, reminding everyone that the front line was dangerously close. Volkov gripped the doctor's wrist with surprising strength and whispered that he didn't want to die far from home. The simplicity of that confession cut Alexander more deeply than any superior's criticism, for it revealed the brutal responsibility he carried. Every medical decision meant the difference between a mother welcoming her son back or receiving an official letter. Lieutenant Dmitry Karasin, a medical assistant for 3 years, approached carrying a tray with the last vials of morphine. His practical experience contrasted with Alexander's theoretical knowledge, creating a silent tension in every medical decision. Karasin had learned surgery in the trenches of Stalingrad, where saving lives meant improvising with metal scraps and dirty rags, while Alexander mastered sophisticated techniques that depended on equipment they didn't have. The metallic smell of surgical instruments, most adapted from household utensils requisitioned from abandoned homes, created a desperate atmosphere of improvisation that defined this impossible hospital. Karasin set the tray on the altar-turned operating table and looked directly into Alexander's eyes, a silent question hanging between them. The morphine would suffice for 3 surgeries, but 8 critical cases awaited treatment. Alexander picked up a vial, felt the cold glass against his palm, and made the decision that would define his career. Operating on all without adequate anesthetic was better than letting 5 die without a chance. Sergeant Medic Natalia Smirnova was organizing bandages made from torn uniform rags when the first mortar shell exploded 200 meters from the church. The blast made the remaining shards of stained glass tremble in their ruined frames, a melancholy chime mixing with the wounded men's moans. Natalia, a veteran nurse from Kursk, possessed the rare ability to stay calm under bombardment, a skill Alexander secretly admired. She had seen more death in the last 2 years than most soldiers in the entire war, Yet she retained a genuine tenderness in caring for the wounded that inspired trust even in the most desperate moments. The metallic clatter of shrapnel striking the stone roof created a sinister symphony, accompanying every medical procedure, a constant reminder that they operated on the front line of a lost battle. Natalia looked at Alexander and gave a silent nod, a gesture that communicated more than words. She was ready to face the approaching hell. Her skillful fingers kept preparing bandages as distant explosions cast orange flashes inside the church, creating dancing shadows that transformed the sacred space into a scene of total war. Corporal Medic Sergei Petuchov, a specialist in treating traumatic shock, was checking the vital signs of the gravely wounded when the news everyone feared arrived. A messenger, a boy no older than 17, his face covered in mud and blood, burst through the church's main entrance carrying the official order that would seal the unit's fate. Petuchov, a man of few words but precise hands, had learned to read death in soldiers' eyes, a dark skill that made him indispensable in extreme situations. The paper the messenger handed to Alexander trembled slightly, not from the cold wind entering through the shattered windows, but from the weight of the information it held. The supply lines had been cut by the Germans, completely isolating the field hospital from the rest of the Allied forces. There would be no medical reinforcements, no additional medicines, no evacuation of the gravely wounded. Alexander folded the paper slowly, feeling the rough texture of the military document against his fingers, and looked at his four-person team awaiting instructions. The silence that followed was broken only by the distant sound of German machine guns, a brutal reminder that the war would not wait for their medical decisions. Now we will find out if medicine can triumph where strategy has failed. Chapter 2. Desperate Improvisation. The first surgery without adequate anesthetic began at 3 in the morning. When German bombardment paused temporarily, Alexander placed his hands on soldier Volkov's abdomen, feeling the irregular pulse through cold, damp skin, while Karasin held the young man's shoulders to prevent sudden movements. The improvised scalpel, fashioned from a razor blade welded to a wooden handle, cut the skin with surgical precision that surprised even Alexander. The metallic smell of blood intensified in the church's cold air, mixing with the scent of candles Natalia had lit on the altar for extra light. Volkov bit down on a piece of leather to stifle his screams, his wide eyes reflecting the dancing flames as Alexander located the shrapnel lodged between his ribs. The jagged texture of the German metal under his fingers revealed the complexity of the extraction. Removing the fragment without puncturing vital organs demanded techniques he had studied only in theoretical manuals. Petuchov monitored the vital signs with total concentration, whispering numbers that signaled the dangerous nearness of surgical shock. Every second of hesitation could cost the soldier's life, but too much haste would guarantee his death. The shrapnel came out with a gush of dark blood that stained the stone altar-turned operating table. Alexander worked with controlled speed, suturing torn vessels with silk thread taken from a captured German parachute, an improvisation that proved better than official surgical materials. The sound of his focused breathing blended with Volkov's muffled groans, creating an intimate symphony of struggle against death that defined this sacred space-turned medical arena. Natalia anticipated Alexander's every move, handing him clean instruments and arranging dressings with an efficiency only years of battlefield experience could provide. Candlelight cast dancing shadows on the stone walls, creating the illusion that medieval saints watched the surgery with silent approval. Karasin, still holding Volkov's shoulders, murmured an Orthodox prayer his grandmother had taught him in childhood, the words in Old Slavonic echoing softly through the Gothic space. When Alexander tied the final suture, Volkov had lost consciousness, but his breathing remained steady. The first victory against death without proper resources had been achieved. The second patient, Sergeant Ivan Makarov, had a gunshot wound to the lung that threatened to cause suffocation from internal bleeding. Alexander examined the pierced chest, located the entry wound, and mentally calculated the projectile's path through ribs and intercostal muscles. The chest drainage technique required had never been performed in such precarious conditions, but the alternative was to watch Makarov drown in his own blood. Petuchov prepared a drainage tube, improvised from a rubber hose found among the wreckage of a military vehicle. sterilizing it with homemade alcohol distilled from potatoes requisitioned from an abandoned farm. The strong smell of the potato alcohol spread through the church, temporarily overriding the sense of blood and incense that permeated the air. Alexander made the incision between the ribs with millimetric precision, feeling the resistance of cartilage beneath the blade, while Makarov remained conscious, his gaze fixed on the ruined ceiling. Inserting the drainage tube produced a wet, unsettling sound, immediately followed by the flow of blood and air that relieved the pressure on the lung. Makarov drew a deep breath for the first time in hours, a sound that filled Alexander's heart with a rare sense of professional satisfaction. News that German doctors had set up an outpost barely a kilometer from the church came from an Italian partisan who had managed to cross enemy lines. The middle-aged man, wearing mud-stained civilian clothes, spoke rudimentary Russian mixed with Italian, but his message was clear. The Germans were evacuating their own wounded, with an efficiency that cruelly contrasted with the abandonment suffered by the Soviet medical unit. Alexander felt a mixture of envy and determination as he imagined his German colleagues working with proper anesthetics, modern antibiotics, and appropriate surgical equipment. The partisan described enemy doctors operating on the wounded in heated tents, with generators supplying electric light, conditions that seemed like science fiction compared to the bombed-out church. Natalia translated the Italian parts Alexander did not understand, revealing details about German techniques for treating shrapnel wounds that could be adapted to Soviet circumstances. The partisan also brought crucial information. The Germans planned a coordinated attack at dawn to eliminate the last point of medical resistance in the region. Alexander looked at his 16 patients, some still awaiting surgery, and realized he had less than 4 hours to prepare them for evacuation or to turn the church into a fortress. The decision was made without consulting high command, because there was no time for military bureaucracy when lives depended on immediate action. Alexander gathered his medical team around the altar and laid out a plan that defied every military convention. Transform the field hospital into a treatment post for the wounded of both sides, creating a medical neutral zone the Germans would respect under the Geneva Conventions. Karasin questioned the legality of the proposal, reminding them that fraternizing with the enemy was punishable by summary execution. But Alexander argued that saving lives transcended nationality when it came to medicine. Petushov, ever pragmatic, noted that treating German wounded could yield valuable information about advanced surgical techniques, as well as confiscated medicines that would benefit the Soviet patients. Natalia immediately supported the idea, reminding them that her medical vocation recognized no political borders when it came to relieving human suffering. The Italian partisan, who had remained silent during the discussion, offered to mediate the first contact with the German doctors, using his status as a neutral civilian to propose a medical armistice. Alexander felt the weight of responsibility on his shoulders, knowing this decision could save them or doom them, but also aware that remaining passive would guarantee the death of all the wounded. If High Command has abandoned us, we will create our own rules to save whoever we. Gennady, the German doctor who appeared at the church, entrance carried a black leather medical bag and a makeshift white flag, fashioned from a bedsheet tied to a wooden pole. Hauptmann Wilhelm Straub, a military surgeon with 15 years of experience on European battlefields, surveyed the church interior with a professional eye that assessed both the harsh conditions and the evident medical skill shown in the treatment of the wounded. Alexander advanced slowly, keeping his hands visible, and speaking in the German he had learned at university, proposing a medical armistice that could benefit the wounded of both nationalities. The scent of German ether rising from Straub's bag contrasted with the improvised smells of the Soviet hospital, creating an olfactory mix that symbolized the difference in resources between the two armies. Straub observed Volkov recovering from abdominal surgery and Makarov breathing normally through the chest drainage tube, a silent evaluation that acknowledged technical competence despite the scarcity of equipment. The smooth German leather of the medical bag, when Straub opened it to reveal gleaming surgical instruments, stirred involuntary envy in Alexander, but also hope that this impossible cooperation might truly work. The metallic clink of German instruments being laid out on the altar created a symphony different from Soviet improvisation, but with the same fundamental goal: preserving human life. The first joint surgery took place an hour later, when a German soldier wounded by mortar shrapnel was carried in by two comrades who respected the medical neutral zone that had been established. Obergefreiter Hans Müller, 22 years old, had lost massive amounts of blood from a femoral artery wound that his comrades had failed to stem adequately. Alexander and Straub worked side by side, communicating in medical Latin when German or Russian proved insufficient for describing complex technical procedures. The contrast between Alexander's improvised scalpel and Straub's precision German instruments created a surreal yet efficient medical partnership that impressed both teams. Natalia assisted Straub with the same dedication she showed the Soviet doctors, learning German suturing techniques that could be applied to the remaining wounded. The smell of German anesthetic, pure ether rather than homemade alcohol, gave Miller a pain-free operation that brutally contrasted with the suffering of the Soviet soldiers. Karasin watched Straub's every move, memorizing hemorrhage control techniques that could save dozens of lives in the future. When the artery was repaired and Müller stabilized, both doctors exchanged a look of mutual professional respect that transcended nationality and ideology. The exchange of medical knowledge began informally, but soon evolved into a systematic collaboration that benefited the wounded on both sides. Straub demonstrated German techniques for treating traumatic shock using artificial plasma developed in Nazi military laboratories, knowledge Alexander eagerly absorbed to apply to Soviet soldiers. In return, Alexander showed improvisational surgical methods that impressed Straub, particularly sterilization techniques using minimal resources that could prove useful should the Germans face similar shortages. The sound of medical conversation in 3 languages, Russian, German, and Latin, created a surreal academic atmosphere in the middle of the war zone, as if the bombed-out church had turned into an international university of emergency medicine. Petuchov learned from the German assistant new methods for treating burns with synthetic ointments, superior to the folk remedies of Soviet tradition, knowledge that would save lives in the coming months. Natalia exchanged nursing techniques with the German orderly Schwester Greta, discovering infection prevention methods effective even without modern antibiotics. The different texture of the German dressings, made of synthetic material rather than improvised rags, revealed industrial advances that could be replicated using local resources. This exchange transformed both medical teams into a more competent technical hybrid than the sum of their original parts. Tension arose when casualties arrived from a nighttime skirmish between German patrols and Italian partisans, placing doctors of both nationalities in a delicate position. 2 wounded partisans and 1 injured German soldier arrived simultaneously, all needing urgent surgery, but carrying between them the political hatred that fueled this endless war. Alexander and Straub looked at each other, knowing the situation would test the limits of the medical armistice they had established. The more seriously injured partisan, a 40-year-old man with an abdominal wound similar to Volkov's, regarded the German doctors with suspicion, while the wounded soldier muttered insults about Italian terrorists even in his state of shock. The smell of gunpowder still clung to the clothes of all the wounded, a reminder that the battle outside the church continued, merely paused by the medical agreement. Straub made the decision that would define the armistice's success. He would operate on the Italian partisan with the same dedication he gave to wounded Germans. Establishing a precedent of absolute medical neutrality, Alexander took charge of the German soldiers' treatment, a reciprocal gesture that solidified mutual trust between the medical teams. The dual surgery, performed simultaneously at opposite ends of the altar, created a powerful symbol of medicine transcending politics, even if only for a moment. The German attack predicted for dawn was cancelled when enemy command learned of the medical armistice established in the church. A radio message, intercepted by damaged Soviet communications equipment, revealed that senior German officers had approved the neutral medical zone as a humanitarian experiment, consistent with international laws of war. Alexander felt relief mixed with apprehension, knowing that this exceptional situation would not last indefinitely, and that eventually, they would have to face the political consequences of fraternizing with the enemy. Straub shared the same concern, for German doctors could also be accused of treason for cooperating with Soviet physicians and treating Italian partisans. The distant sound of German military vehicles pulling away from the area confirmed the temporary cancellation of offensive operations, providing the breathing space needed to consolidate ongoing medical treatments. Petuchov observed that the wounded on both sides were recovering faster when treated with a combination of Soviet and German techniques, empirical evidence that medical cooperation produced results superior to national competition. Natalia noticed a subtle change in the church's atmosphere. Enemy wounded were beginning to look at each other as fellow sufferers rather than political adversaries, a humanizing effect that naturally occurred when physical pain overshadowed ideology. The comforting texture of German dressings applied by Soviet hands, and vice versa, created a tactile symbol of temporary peace built on mutual medical necessity. For a few hours, medicine accomplished what generals and politicians cannot. It turned enemies into human beings. The arrival of a senior Soviet officer at midnight shattered the fragile armistice that had turned the church into an oasis of medical cooperation. Colonel Alexander Volchansky, a division commander known for strict discipline, burst into the field hospital with 4 armed soldiers, his face twisted with rage at the sight of Soviet doctors treating German wounded. The sound of military boots marching across the stone floor echoed through the church like a death sentence, cutting off the multilingual medical discussions that had created an atmosphere of international collaboration. Alexander rose slowly from beside a German soldier he was suturing, feeling the weight of a moment that could define his career and possibly his life, while Volchansky shouted accusations of treason that reverberated off the Gothic walls. The cold sweat of fear mingled with the familiar medical odors, creating a tense atmosphere that made every wounded man, regardless of nationality, understand that something terrible was about to happen. Straub stood motionless beside the operating table, hands still holding blood-stained instruments, waiting for a development that could end in summary execution for everyone involved. The 4 Soviet soldiers leveled their weapons at the German doctors, creating a military standoff in the middle of a neutral medical zone that had held for nearly 12 hours. Volchansky ordered Alexander's immediate arrest for treason against the Soviet state, a crime punishable by death under wartime military regulations. The cold cuffs closed around Alexander's wrists with a brutal finality that contrasted with the delicacy of his surgeon's hands, a symbolism not lost on anyone present. Karasin stepped forward, declaring that the entire medical team supported Alexander's decisions and shared responsibility for the armistice, a gesture of loyalty that surprised and moved the young surgeon. Natalia joined Karasin, followed by Petuchov, forming a human barrier around Alexander that directly challenged Volchansky's authority. The colonel hesitated, realizing that arresting the entire medical staff in the middle of a battle would be strategic suicide, since no replacements were available to treat the Soviet wounded still in urgent need of care. The groans of the injured, Soviet and German alike, created a soundtrack reminding everyone that political debates were a luxury amid immediate medical necessity. Straub broke the silence in hesitant Russian, offering to leave voluntarily with his team if it would resolve the conflict, but to leave behind German medicines to benefit the Soviet wounded. The rough bite of the cuffs on Alexander's wrists became a physical reminder that medicine and politics rarely coexist peacefully, even when human lives are at stake. Soldier Volkov, still recovering from the abdominal surgery Alexander had performed, slowly pushed himself up from the improvised cot to defend the doctor who had saved his life. His voice, weak but resolute, carried through the church as he described how Alexander had operated without proper anesthetic, using improvised techniques that showed exceptional competence under impossible conditions. Other wounded Soviets joined in, creating a chorus that turned the hospital into an improvised courtroom where patients defended their saviors. Makarov, breathing normally thanks to the chest drainage tube, explained how medical cooperation had produced superior treatment for all the wounded, regardless of nationality. The Italian partisan, operated on by Straub with Alexander's assistance, stood with the help of an improvised cane, and declared in broken Russian that doctors have no homeland when it comes to saving lives. Volchansky looked around the church and saw 16 living wounded, who would likely be dead without Alexander's skill and the international cooperation that had been established, empirical evidence that challenged his rigid political convictions. The smell of German medicines mingled with Soviet improvisations created a unique aroma of collaboration, symbolizing the medical success achieved through heterodox methods. The comforting feel of clean dressings and well-placed sutures spoke louder than ideological arguments about the practical consequences of the medical armistice. German artillery resumed at 2 a.m, this time targeting Soviet positions away from the church, an implicit respect for the established medical neutral zone. Volchansky realized that canceling the armistice would bring immediate bombardment of the field hospital, instantly killing all the Soviet wounded his doctors had managed to save. The decision he made surprised even his own soldiers. He authorized the temporary continuation of medical cooperation, but under direct military supervision, a compromise that preserved his authority while acknowledging practical necessity. Alexander felt the cuffs being removed, circulation returning to his wrists with a tingling that symbolized a return to conditional freedom. Fully aware his situation remained precarious despite the temporary victory, Straub and his German team were permitted to continue treating the wounded in the church, but under constant watch by Soviet soldiers to ensure no military information was passed along. The metallic clatter of lowered weapons created an atmosphere of tense truce that allowed the medical work to continue under political oversight. Natalia resumed preparing dressings with an efficiency that masked the relief of having averted total disaster, while Karasin and Petuchov went back to checking patients' vital signs as if nothing had happened. The familiar feel of surgical instruments in Alexander's hands signaled a return to medical normalcy that briefly transcended the political complications threatening to destroy everything they had built. The moment that would decide everyone's fate came when a massive German attack struck the main Soviet positions, leaving the church as the only medical stronghold within 50 square kilometers. Messengers arrived in succession with increasingly desperate news. Military hospitals evacuated, medical units in retreat, hundreds of wounded without adequate care converging on the bombed-out church as their last hope of survival. Alexander looked at Volchansky and saw on the colonel's face the brutal recognition that political decisions about medicine had become irrelevant in the face of the looming humanitarian catastrophe. The distant sound of German military vehicles approaching, mixed with the cries of wounded men being carried by desperate comrades, creating a wartime symphony that demanded immediate medical action without ideological considerations. Straub stepped close to Alexander and whispered in German that he had received orders to evacuate, but he offered to stay voluntarily if his expertise could save more Soviet lives. The rough texture of the German written orders in Straub's hands embodied the moral dilemma between military obedience and medical vocation that would define his career and conscience. Confronted with the arrival of 80 additional wounded and only 4 doctors available, Volchansky made a decision that violated every regulation. He officially authorized international medical cooperation in the name of urgent military necessity. When death arrives en masse, doctors can't afford to be patriots. The simultaneous arrival of 80 wounded turned the church into a scene of controlled chaos, where every second determined who would live or die. Alexander organized a triage system that divided the newcomers into 3 categories: urgent cases that could be saved with immediate surgery, stable wounded who could wait for treatment, and those so gravely injured that only palliative care was possible. The smell of fresh blood intensified sharply, mixing with the odors of gunpowder and sweat that soaked the torn uniforms of the newly arrived soldiers. Straub took charge of a second improvised surgical table, made from church benches covered with clean sheets, establishing a medical assembly line that combined German factory-like precision with Soviet improvisation. The groans in multiple languages, Russian, German, Italian, and even Hungarian, created a babel of suffering that demanded a universal understanding of human pain beyond technical competence. Natalia coordinated 6 makeshift assistants recruited from the less seriously wounded. turning soldiers into medical aides through basic instructions in sterilization and hemorrhage control. Karasin and Petuchov moved among the injured with the efficiency of veterans, prioritizing cases based on survival probabilities calculated through brutal experience gained on previous battlefields. The sticky texture of coagulated blood on the church's stone floor became a physical obstacle that forced them to adapt their movements to avoid slipping during delicate procedures. Volchansky stood silently in a corner, watching international medical cooperation achieve an efficiency his own military units rarely matched. The first emergency surgery of the early morning involved a Soviet soldier with a cranial wound threatening death from excessive intracranial pressure. Alexander had never performed neurosurgery in field conditions, but German manuals brought by Straub contained detailed illustrations of cranial drilling techniques that could relieve the pressure and save basic brain functions. The flickering candlelight cast dancing shadows that complicated the surgical precision required for such a delicate procedure, forcing Natalia to hold improvised mirrors to direct extra light onto the operating area. The sound of the hand drill penetrating cranial bone, an instrument adapted from carpentry tools found in the sacristy, sent shivers through everyone present, all aware of the extreme gravity of the procedure. Straub guided each of Alexander's movements with whispered medical Latin, transferring German neurosurgical knowledge to Soviet hands in real time, during an operation that could result in death or permanent disability. The smell of bone being drilled mixed with the familiar medical odors, creating a unique aroma of extreme surgery that none present would ever forget. When cerebrospinal fluid began to drain through the opening, easing the pressure that threatened vital functions, the soldier moved his finger slightly, sign that his neural connections remained intact. The slick texture of the cerebrospinal fluid on Alexander's improvised gloves represented the boundary between life and neurological death that he had successfully crossed. Petuchov monitored vital signs throughout the procedure, reporting a gradual stabilization that confirmed the success of the improvised neurosurgery. The second critical case involved a German soldier with multiple abdominal wounds, requiring the removal of shrapnel lodged dangerously close to vital organs. Straub took command of the main surgery while Alexander assisted, reversing their usual hierarchy to maximize success based on each doctor's technical expertise. The German patient, Unteroffizier Klaus Weber, remained conscious during surgical preparation, looking directly into the eyes of the Soviet doctors who would work to save him, despite the political hostilities between their nations. Medical cooperation had evolved beyond a temporary armistice into a genuine professional partnership, founded on mutual respect for technical skill and humanitarian dedication. Karasin prepared local anesthesia, using a combination of German morphine and Soviet alcohol, a mixture that provided better pain relief than anything either army could offer alone. The metallic sound of German instruments handled by Soviet hands created a symphony of cooperation, symbolizing the temporary transcendence of national barriers through shared medical necessity. Natalia anticipated Straub's needs with the same efficiency she showed when assisting Alexander. Clear evidence that universal medical competence outweighed cultural differences when lives were at stake. The different texture of the German surgical materials offered a new tactile experience that expanded the Soviet team's technical skills through exposure to superior technologies. Weber murmured "Danke" in German as the local anesthetic began to ease his abdominal pain, a simple word carrying profound recognition of the shared humanity between political enemies united by physical vulnerability. The third simultaneous surgery tested the absolute limits of the improvised medical capacity when Italian partisans brought in a civilian, injured by a bombardment that had destroyed her home on the outskirts of the combat zone. Maria Benedetti, a 50-year-old woman, suffered complex internal injuries requiring exploratory abdominal surgery to locate internal bleeding before she lost too much blood to survive. Alexander and Straub worked together at the main operating table, combining Soviet improvisational techniques with German precision to navigate the female anatomy complicated by age and multiple wounds. Operating on an Italian civilian created a powerful symbol of medicine, transcending not only military nationalities, but also the distinction between combatants and the non-combatant population. Petuchov monitored Maria's vital signs while Karasin prepared a blood transfusion using volunteer donors recruited from wounded soldiers of both nationalities who had offered themselves spontaneously. The smell of German ether mixed with Soviet disinfectant created a hybrid surgical atmosphere that worked better than any single national protocol applied in isolation. Natalia coordinated medical assistants speaking basic Italian she had learned during the occupation, communication that comforted Maria during moments of consciousness between doses of anesthetic. The delicate texture of the woman's internal tissues demanded special care, testing the manual dexterity developed while treating young, resilient soldiers and forcing both doctors to adapt their techniques to different physiology. When the internal bleeding was located and controlled, Maria opened her eyes and smiled faintly, an expression of gratitude that crossed both linguistic and political boundaries to touch the hearts of everyone present. Volchansky, watching an Italian civilian saved by German-Soviet medical cooperation, began to understand that war possessed humanitarian dimensions that transcended conventional military strategy. The highest tension came when a German patrol arrived at the church to evacuate Straub and his team, creating a standoff that threatened to interrupt ongoing surgeries and cause the death of patients who had just been stabilized. Hauptmann Friedrich Krüger, the German officer responsible for the evacuation, encountered a situation that defied military regulations. German doctors saving Soviet lives, while Soviet doctors treated German wounded in a cooperation that benefited both sides. Alexander continued operating on the wounded German soldier, while speaking to Krüger, demonstrating that any forced interruption would result in the death of a fellow German who could be saved with another 30 minutes of surgery. Straub explained rapidly in German that immediate evacuation would violate the Hippocratic Oath and lead to unnecessary deaths of wounded men of both nationalities who depended on medical cooperation for survival. The sound of German vehicles idling outside the church created a time pressure that heightened the drama of negotiating between military duty and medical responsibility. Krüger examined the German wounded being competently treated by Soviet doctors, visual evidence that complicated his mission of forced evacuation. Volchansky stepped forward to Krüger and proposed an official 6-hour extension of the medical armistice, enough time to complete critical surgeries and stabilize the most serious patients before any evacuation. The cold texture of German weaponry contrasted with the human warmth of medical cooperation, a symbolism not lost on the soldiers on both sides who watched the negotiation. Krüger hesitated, understanding that the decision he made at that moment would define not only the immediate medical outcome, but also set a precedent for future situations in a war that seemed endless. 6 hours to prove that medicine can be stronger than all wars. The 6-hour extension of the medical armistice turned the church into a laboratory of international cooperation, where political enemies discovered shared humanity through their joint work to preserve life. Krüger established a defensive perimeter around the church, coordinating with Volchansky, a mutual security system that protected doctors of both nationalities against attacks by third parties who did not respect the medical neutral zone. The smell of fuel from the German military vehicles mingled with the medical odors inside, creating a hybrid atmosphere of war and peace that defined this exceptional moment in history. Alexander used the additional time to teach Soviet techniques of improvised surgery to the German medical students, accompanying Straub, knowledge that would benefit future German wounded. Natural daylight began to filter through the shattered stained glass, providing illumination that improved surgical precision after hours of working only by candles and improvised lanterns. Straub demonstrated the use of German sulfanilamide to prevent post-operative infections, medicine that was then applied retroactively to the Soviet wounded operated on in the preceding hours. Natalia organized a rotation system among the makeshift assistants, ensuring that exhaustion would not compromise the quality of medical care during this critical recovery period. The sound of conversations in multiple languages created a medical babble in which universal technical terminology allowed efficient communication among healthcare professionals regardless of their national origin. The comforting texture of clean dressings and proper medications brought a sense of medical normalcy that contrasted sharply with the desperate improvisation of the previous hours. The fourth surgery of the night involved a complex case of a Hungarian soldier who had fought alongside the Germans and suffered a chest wound that punctured a lung and threatened cardiovascular collapse. Sergeant Fekete István, 24 years old, spoke only Hungarian and basic German, creating a language barrier overcome through universal gestures of reassurance and evident medical competence. Alexander performed the second chest drainage of his career, this time assisted directly by Straub, who guided each movement with his superior knowledge of complex pulmonary anatomy. The German technique for inserting a chest tube proved more efficient than the improvised Soviet method, a practical lesson Alexander absorbed for future use on his own countrymen. Karasin monitored István's breathing, while learning basic Hungarian words to communicate with the patient during moments of consciousness, an effort that demonstrated medical dedication transcending cultural barriers. The smell of Hungarian blood was indistinguishable from Soviet or German blood, a biological reality, symbolizing the fundamental unity of humanity beyond artificial political divisions. Petuchov prepared a mixture of Soviet and German analgesics, a pharmacological combination that provided pain relief superior to any single national protocol. The different texture of István's lighter skin, compared to most Soviet patients, reminded them of the ethnic diversity within the armies fighting the war, but did nothing to alter the universal medical principles applied during treatment. Natalia softly hummed a Russian folk melody that calmed István despite the language difference, music functioning as a universal language of human comfort. When István's breathing stabilized completely, he murmured "Köszönöm" in Hungarian, a word everyone understood as gratitude, regardless of literal translation. The discovery of a Soviet soldier with a wound identical to István's allowed a direct comparison of the effectiveness of German versus Soviet techniques applied simultaneously. Artillery Corporal Sergei Dmitriev, 22, had suffered a similar lung puncture during German bombardment, but arrived at the church 3 hours after István, making it possible to apply the knowledge gained during the previous surgery immediately. Alexander used the German chest drainage technique taught by Straub, while Straub applied the Soviet method of hemorrhage control taught by Alexander, an exchange of knowledge that benefited both patients at once. Dmitriev's recovery was visibly faster than previous cases treated with only Soviet techniques, empirical evidence of the superiority of a collaborative medical approach. Kruger watched as a Soviet soldier was saved by German techniques applied by a Soviet doctor, a paradox that challenged his traditional understanding of national loyalties in wartime. The sound of both patients' steady breathing created a medical harmony, symbolizing the success of international cooperation in preserving human life. Volchansky compared survival rates before and after the arrival of the German doctors, finding a 40% improvement that justified the continuation of medical collaboration. The identical texture of the dressings applied to both soldiers, made with mixed German and Soviet materials, created a visual equality that transcended political nationalities. Natalia noticed that Dmitriev and István, though political enemies, exchanged gestures and smiles about their shared near-death experience and miraculous recovery. Petuchov documented the hybrid techniques developed during the cooperation, creating an informal medical manual that could benefit future wounded from both nations. The fifth surgery tested ethical limits when a wounded German known to have participated in a massacre of Italian civilians the week before arrived. Information brought by partisans who knew his identity. Oberscharführer Heinrich Wolf, a 30-year-old SS officer, was unconscious from a severe cranial wound, but documents found in his uniform confirmed his involvement in atrocities against the civilian population. Alexander faced a profound moral dilemma: to uphold the Hippocratic oath to save lives, regardless of personal considerations, or to allow a war criminal to die through justifiable medical neglect. Straub also hesitated, understanding that treating Wolf could be interpreted as condoning the crimes committed, but refusing medical assistance would violate the fundamental principles of his profession. The Italian partisans present in the church pressed for Wolf to be left to die, arguing that saving a murderer of civilians was a moral betrayal of innocent victims. Volchansky remained neutral, declaring that medical decisions were not a military responsibility, a transfer of authority that placed the full weight of the choice on the doctor's shoulders. The smell of Wolf's blood was identical to that of his victims, a biological reality that complicated moral judgments based on past political actions. Alexander made the decision that would define his conscience for the rest of his life. He would operate on Wolf with the same dedication he gave any patient, because medicine could not become an instrument of justice without losing its humanitarian essence. The cold texture of Wolf's skin during the pre-surgical examination revealed no moral evil, only the universal human vulnerability that transcends political crimes. Straub supported Alexander's decision, establishing a precedent of absolute medical neutrality that would be tested again in similar future situations. The most dramatic moment of the medical cooperation came when Soviet artillery began bombarding nearby German positions, threatening to strike the church and halt ongoing treatments. Kruger received a radio order to evacuate all Germans from the bombardment zone immediately, including doctors and wounded who could not be moved without risk of death. Alexander proposed a desperate solution: transfer the critically wounded Germans to the church basement, a protected space that could withstand indirect shelling, while Soviet wounded remained on the main floor. Straub refused to abandon critically injured German patients, declaring that forced evacuation was a death sentence for soldiers who could be saved with continued care. Volchansky used the Soviet military radio to contact the artillery, explaining the exceptional medical situation and requesting a temporary suspension of the planned bombardment. The sound of artillery shells passing over the church created extreme tension that tested everyone's nerves, as doctors and patients alike knew death could arrive at any moment. Natalia organized the rapid evacuation of mobile wounded to the basement, a coordinated movement that saved lives when the first explosion struck ground 100 meters from the church. Karasin and Petuchov carried unconscious patients down the narrow basement stairs, a physical effort requiring the cooperation of both German and Soviet soldiers working side by side. The damp texture of the medieval basement walls contrasted with the improvised surgical environment upstairs, but provided the physical safety needed to continue medical treatments. Kruger made a decision that violated direct military orders. He remained in the church with his team, choosing medical responsibility over military obedience. In the end, we discovered that healing the wounded is more important than winning wars. The Soviet bombardment lasted 2 hours, but was executed with a precision that spared the church while destroying German military positions within a 500-meter radius. Alexander and Straub worked in the medieval basement throughout the shelling, performing surgeries by candlelight, while explosions shook the stone structure overhead. The basement's acoustics amplified the sounds of surgery, the metallic clink of instruments, the focused breathing of the doctors, the muffled groans of patients, creating a medical symphony that contrasted with the destruction raging outside. The smell of gunpowder seeping through cracks in the stone mingled with the familiar medical odors, a constant reminder that life and death coexisted, separated only by the medieval stone walls. Natalia coordinated nursing care for 23 wounded crammed into the confined space, organizing a rotation system that ensured proper attention for each patient, despite the claustrophobic conditions. Karasin discovered a source of potable water in an abandoned cistern, a resource that allowed proper sterilization of instruments and hydration of the dehydrated wounded. Petuchov monitored vital signs with a German pocket watch borrowed from Kruger, precise timing that became crucial when improvised anesthetics required minute-by-minute dosage calculations. The rough texture of the stone walls provided physical support when doctors needed stability during delicate procedures performed in awkward positions. Volchansky descended into the basement to check on the medical situation and found German and Soviet soldiers sharing blankets and water, an image of fraternity that challenged his most fundamental military convictions. The final surgery of the medical collaboration involved the most complex case of the entire experience. A Soviet soldier with multiple injuries requiring cardiovascular surgery beyond the individual skills of any doctor present. Captain Vasily Petrov, a 28-year-old officer, had suffered a chest wound that pierced his heart, an injury normally fatal. But he had reached the church within the narrow window that allowed surgical intervention. Alexander possessed theoretical knowledge of cardiac surgery from advanced medical manuals, but had never performed such a delicate procedure, while Straub had limited practical experience with cardiovascular repairs in German military hospitals. Their cooperation reached a level of professional integration that transcended nationality, each compensating for the other's limitations to create a surgical competence greater than the sum of their individual skills. The sound of Petrov's injured heart, irregular and weak, served as an urgent metronome timing every surgical movement during the 3-hour operation. Natalia acted as an improvised perfusionist, manually maintaining blood circulation, while the doctors worked directly on the exposed heart muscle. Karasin monitored blood pressure using German techniques taught only minutes earlier, knowledge transferred in real time during an emergency that left no room for formal training. The delicate texture of the cardiac tissue demanded extreme care, testing the manual dexterity developed over months of battlefield surgery. Each suture a potential instant death if misplaced. Petuchov prepared cardiotonic medications by combining Soviet and German stimulants, an improvised formula to strengthen the damaged heart during the critical recovery period. Kruger watched a German doctor save a Soviet officer who had likely killed German soldiers, a moral paradox that called into question the very logic of war. Petrov's recovery became the symbol of medical cooperation when he awoke speaking basic German learned during the occupation of conquered territories, enabling direct communication with Straub, who had repaired his heart. The irony of the situation, a Soviet officer conversing in German with the doctor who had mended his heart, was not lost on anyone present, a powerful symbol of humanity transcending political borders. Alexander documented the hybrid surgical technique developed during the operation, a combination of Soviet and German methods that could save future cardiac patients regardless of nationality. Straub taught postoperative cardiac recovery procedures to the entire Soviet medical team, transferring knowledge that would benefit heart-injured soldiers for years after the war. The smell of German cardiotonic medicines administered by Soviet hands created an aroma of medical collaboration that defined the essence of the shared experience. Natalia observed that Petrov and other Soviet wounded showed genuine gratitude for German care, a human recognition that complicated official narratives of inhuman enemies. Volchansky spoke at length with Petrov about his experience of being saved by enemy doctors, a dialogue that shifted the colonel's military perspective on the nature of modern war. The smooth texture of Petrov's perfectly sutured heart scar became a permanent physical reminder that international cooperation had saved his life. Kruger wrote an official report describing the Soviet medical competence he had witnessed during the collaboration, a document that would challenge German stereotypes of enemy inferiority. The end of the medical armistice came with simultaneous radio orders from both military commands, demanding the immediate separation of the medical teams and a return to conventional hostilities. Alexander and Straub exchanged personal addresses and promised to correspond after the war, if both survived the conflict spreading across Europe. The division of patients was negotiated with humanitarian care that prioritized medical needs over political considerations, leaving the gravely wounded in the care of whichever team was most qualified for their specific cases, regardless of nationality. Natalia embraced the German medical assistant Greta, a farewell between women that symbolized the human connections formed during their shared struggle to preserve life under bombardment. Karasin and Petuchov copied the German techniques learned during the collaboration, knowledge they would apply in treating Soviet wounded during the remaining months of the war. The sound of German military vehicles departing created an auditory void that contrasted with the medical babble of the preceding days, a silence symbolizing the return to the reality of national conflict. Kruger left half of the German medicines for the Soviet wounded, who still required treatment, a humanitarian gesture that violated military supply regulations, but honored the medical commitments established. Volchansky wrote an official report praising Alexander's competence without mentioning the cooperation with German doctors, a bureaucratic protection that would safeguard the young surgeon's career. The familiar texture of Soviet surgical instruments, after days handling superior German equipment, reminded Alexander of the material limitations he would continue to face for the rest of the war. Straub left behind a German medical manual translated into Russian, a gift that would expand the Soviet team's surgical knowledge far beyond the experience of 3 days of collaboration. The legacy of the medical cooperation extended far beyond the end of the war, influencing the careers and lives of all participants for decades. Alexander became chief surgeon of a Soviet military hospital, applying the German techniques learned in the church to save thousands of lives during the rest of the conflict and in post-war reconstruction. Straub survived the war and established a medical clinic in West Germany, where he treated war refugees of all nationalities, using the humanitarian philosophy developed during his cooperation with Soviet doctors. D'Italia specialized in emergency medicine, developing mass casualty treatment protocols that incorporated the German methods of medical organization she had observed during the armistice. Karasin and Petuchov became instructors in military medicine, teaching future generations of Soviet doctors the importance of international cooperation in humanitarian emergencies. The post-war correspondence between Alexander and Straub lasted 30 years, a scientific exchange that contributed to medical advances in both countries during the Cold War. Volchansky was promoted to general and implemented military policies to protect medical personnel on both sides in future conflicts, a direct influence of the experience in the bombed-out church. Captain Petrov, whose heart had been repaired through German-Soviet cooperation, became an advocate for international medical organizations after the war. The scars left by the wounds treated during the collaboration served as permanent physical reminders that medicine could transcend politics when human lives were at stake. Kruger devoted his post-war career to establishing international protocols for the protection of military hospitals, work inspired by the medical cooperation he had witnessed in the Italian church. For 3 days, doctors proved that when it comes to saving lives, they have no nationality. This was our true victory over war. The historical narrative war doctors were ignored by high command until they saved an entire army ends here, revealing how international medical cooperation during 3 days in October 1944 transcended political barriers to save dozens of lives and set humanitarian precedents that would influence military medicine for decades. The Lost Archive documents a rare moment in history when humanity prevailed over hostility, proving that the preservation of human life is a universal value that surpasses national divisions. Even amid the most brutal conflicts of mankind,